Gary Atencio with CNTV, and today we're in Denver, Colorado. We're at the Scleroderma Foundation. Since 1998, this national organization has been providing the support, education, and research for those affected with this disease, not only locally, but nationwide. I am joined today with Cindy and John. Why don't we begin with both of you first. Cindy, share with me a little bit your background and why it is you got involved with this organization.
Well, my background is as a CPA. I've been involved with the organization since 2001 when I helped start the chapter in Colorado, and I got involved because my mother had scleroderma. She passed away from the disease 8 years ago. I'd served as a board member until I came on as our one and only chapter staff person in 2010.
Wonderful. John, let me ask you, as the chapter president here, has this been something that you've been involved with in the past, or is this something that became out of a need to want to give back to the society?
I had a friend that had scleroderma, and I asked her one time how they raised money. She said with a walk in Cherry Creek State Park in June, and so I attempted to volunteer for that, and I was asked to join the board, and I joined the board 5.5 years ago. I'm in the second year of my term as president.
Wonderful. Why don't we begin, first of all, let's educate the viewers out there what this disease is. Kind of give me the short version of it, if you will.
Scleroderma is an autoimmune disease. It literally means hard skin, so patient's skin will thicken and tighten because the body produces too much collagen. It's the body attacking itself with an autoimmune disease. It can go internal and do the same thing to the internal organs. In a lot of cases, patients' gastrointestinal tract, heart, kidneys, lungs will be infected by the disease too.
So basically, as the Greek words imply, we're talking hardening of the skin. And so let me ask you one of the things, is this something that is contagious? I mean, can people be infected by this?
No, and it is believed about 25% of the population is genetically predisposed to an autoimmune disease. The actual cause is not known. More and more they're believing environment plays a factor in it.
Wonderful. Let's begin, first of all, with the symptoms. Obviously, different people have different symptoms. Can you give me an example of possibly like a mild case versus that more of chronic or even life-threatening?
Well, scleroderma is a chronic and progressive disease, and it manifests itself in a number of ways. It can be as limited as Raynaud's phenomena, which is cold hands that are very sensitive to the cold, to the thickening of the skin. Could be gastrointestinal driven with reflux. Many ways it manifests itself. Probably the mildest would be the cold hand syndrome.
Interesting. So as you spoke of earlier, Cindy, basically it can affect different parts of the body. How do they go about diagnosing this?
It is generally a blood test that will confirm or disaffirm the disease, which is not always 100% accurate. If there's skin involvement, a doctor who is familiar with the disease, of which there are not that many, can look at the skin and identify it that way.
Interesting. Do the symptoms, are they similar to other autoimmune? So therefore, is it sometimes hard to diagnose?
Very. A lot of the same symptoms as many other autoimmune diseases. Raynaud's phenomenon, lupus, multiple sclerosis, rheumatoid arthritis, all very similar.
Let me ask you, first of all, when were you diagnosed with the disease, and how long has it been?
I was diagnosed in April of 2013.
2013? Okay. Let me ask you this. Somebody new to the disease here. Was this a disease that you had never heard of before?
No, I had heard of it. I'm a nurse, so I had heard of it. I didn't know a lot about it until I was diagnosed.
Share with me a little bit about what the foundation is able to provide as in the way of support that has been helpful for you.
Education, primarily. The patient education day was very enlightening for me. They've also have good contacts. For example, doctors and specialists that are very important to.
Any time an onset of a disease comes on, be it mild or severe, obviously someone out there feels alone. What would you tell somebody that is possibly just experiencing this right now, and what would you explain to them how the program can help them?
You're not alone, and there are people who understand, and there are people who can help. and help you navigate the medical field, the emotional part of it, and just understand what you're going through and what your family is going through.
Interesting. As you had mentioned before, basically we don't really know what the cause is. We don't have a cure for it. Is this basically why research is so important?
Absolutely. Research continues to be important to find a cause and a cure for the disease. The mission of our chapter and of the national chapter is support of patients and caregivers, of education to both the general public and the medical profession, and research, and the awareness challenge that we have to get funds to complete the research is our biggest challenge.
Wonderful. And obviously, viewers, one of the ways we educate anyone nowadays is through their website. If you take a look at the bottom of the screen right there, what you're going to see is the website. On the website, first of all, you can take a look and see where some of the chapters are located. Possibly if you're not here in Denver, they've got over 24 chapters that are serving the nation. They've got over 150 support groups out there as well. And like Cindy said, always growing and adding to it. Obviously, one of the main reasons, too, is you can get involved with the organization, be it through volunteering or possibly donations as well. Basically just educating and sharing with social media. You can find their Facebook page out there as well. Let's touch on a little bit as far as the program itself, getting involved. I imagine when someone is diagnosed with this disease, the first things they want to do is educate themselves. You make it very possible because of Education Daily, conferences, events. Share with me what goes on at some of these.
Well, our National Patient Education Conference is coming up in July in Anaheim, California. Last year, over 500 patients, caregivers attended that event. Just an opportunity for them to get together, meet each other, and share what's going on with the disease, how it's affecting them personally, may or may not be how it's affecting someone else that they meet. We also have local support groups here in Colorado. Our chapter supports groups in Denver, Fort Collins, Grand Junction, and Colorado Springs. And we also have an annual Patient Education Day for our local members that we partnership with National Jewish Health to present.
Wonderful. So this foundation is providing ways that research can happen, obviously grants out there. I imagine as elections come up, it's important for the public to be out there talking with their representatives, letting them know this is a vital issue with them as well. What about volunteering? Is that something that's needed? I mean, you've got events going on. Is that a way the public can get involved?
Absolutely. We are a volunteer-driven organization. Volunteers are very important to us, because we do have education events, we have fundraising events, and those are supported by a good volunteer staff. So volunteers are always welcome. And we allow volunteers to say, here's my skill set, here's the number of hours I'd like to work, and we match them then with that volunteer job. Yuri, another thing about our advocacy program that is happening right now, in fact, today, we have a group of people on the Hill in Washington, D.C. with a luncheon for the Congress people to learn more about scleroderma. But recently, scleroderma was eligible for research money from the Department of Defense, had been since 2005 to 2014, received about $10 million that was used for research to find the cause and the cure, and the Senate has taken us out of that eligible list. And so I am urging people to write their senators, and it's in the U.S. Senate, to ask them to support scleroderma to be relisted on that eligible research list of diseases.
So very important for an advocate out there. Basically, those voices do matter, because when the research dollars disappear, obviously that's a big detriment to the organization.
Yes, there's most of the private funding is through the Scleroderma Foundation, but the public funding through the Department of Defense is very key.
Wonderful. Last time viewers, take a look at the bottom of the screen right there. You're going to see their website as well as their contact information. We're here at the Denver chapter right here, and it's really easy to get involved. You can become an advocate as simple as maybe contacting your representative, let them know this is an important issue for people to be educated on. You can also volunteer your time, make a donation, become a member, even go online, shop online, and your purchases will go towards the program here as well. Remember that is the Scleroderma Foundation, providing support, education, and research. This is Gary Atensi with CNTV, and if you don't know, now you know.